trying to keep tabs on the mental well-being of young people, it can feel like navigating a maze sometimes, can't it? Especially when you think how much time they spend in school.
Oh, absolutely. Schools are just, there's so much more than places for learning subjects these days. They're really central.
Yeah, central to their whole development. And that's exactly where we're focusing our attention today. We're going to dive deep into a study looking at how Australian schools are actually approaching mental health literacy.
MHL,
All
yeah.
right, MHL. And for everyone listening, mental health literacy, it basically means understanding, what it takes to get and stay mentally healthy.
That's a good way to put it. It's definitely more than just spotting illness. It's knowing about, well, positive things you can do, knowing when and how to get support.
Developing skills for yourself.
Exactly. Those skills for looking after your own well-being.
Precisely. And the researchers behind this specific paper, it's called Australian School Staff and Allied Health Professional Perspectives of Mental Health Literacy in Schools. A mixed methods study. They went straight to the source.
Smart move.
Yeah, they surveyed 88 people across Australia. You've got school staff, teachers, well-being leads, people like that, and then allied health professionals.
So psychologists, counselors.
Exactly, those kinds of roles.
And getting those different perspectives is just so valuable, isn't it? The people on the ground, day in, day out, they often see things most clearly, what's really happening, what's needed.
Couldn't agree more. And our mission today, really, for you listening, is to give you a clear picture of where things stand with MHL in Australian schools right now. We want to look at the key challenges, those different viewpoints we mentioned.
The friction points, maybe.
Yeah, maybe. And what this research suggests might actually help improve things. We'll be focusing on the practical side, the takeaways, and maybe some insights that might be a bit surprising.
Okay, sounds good.
So let's kick off. What does this study actually tell us about this whole concept of MHL? What's the definition they're working with?
Okay, let's unpack MHL based on how the study frames it. They draw on, established definitions. Essentially, it's about having knowledge about mental health,
Okay.
being able to recognize signs and symptoms of, like, mental health conditions, but also understanding what helps promote positive well-being.
Right, the proactive side.
Exactly. Knowing how and where to actually seek help if you need it. And crucially, having the skills to maintain your own mental health. It's pretty broad.
Yeah, it covers a lot. And that seems to line up with the World Health Organization's view, too, doesn't it? They see school staff playing a really key role in fostering student learning generally, and MHL fits right into that.
It does. And the study even mentions this bigger shift happening in education. It's not just about academics anymore, is it?
No, definitely not.
There's this growing understanding that supporting social, emotional, and mental health is, well, integral.
Yeah.
It's part of the whole package of development.
Makes total sense when you look at the bigger picture. I mean, the Australian National Children's Mental Health and Wellbeing Strategy has some clear goals around this, right? Like boosting MHL, making sure schools have a real culture of well-being.
And the study brings up some stats that really show why this is so important. Pretty sobering stuff, actually.
Oh, like what?
Well, they point out that around 1 in 7 Australian kids and adolescents have actually experienced a mental disorder.
1 in 7. Wow.
Yeah, it's a significant number.
It really is.
And then, if you look at slightly older young people, say 12 to 25, they actually have the lowest rates of accessing mental health services.
So the need is there, but they're not getting the help.
Often, yeah,
Mm.
despite the clear need, which just really underlines why these preventative approaches, the stuff schools can do, are so vital.
It really paints a clear picture, doesn't it? Why focusing on MHL in schools isn't just, a nice to have.
It's set.
Yeah, a necessity. So, okay, the study talked to school staff and allied health professionals. What did it find when it compared their perspectives? Were there big differences?
This is where it gets really interesting, I think. One of the standout findings was this, well, really noticeable gap. A gap in how competent school staff feel about delivering MHL content compared to their allied health colleagues.
Okay, so the teachers and well-being staff.
They generally felt less confident, yeah. And they often believed their training for teaching this stuff just wasn't adequate.
That's a really crucial point. If the people interacting with students every day don't feel equipped, that's a barrier right there.
It's a huge barrier. And the researchers actually quantified this. They used statistics, Welch's 2 tests, to see if the difference was significant.
And was it?
Oh, yeah. School staff scored much lower on feeling competent. Average was about 3.27 out of 5 compared to allied health pros at 4.25.
Quite a difference.
And the gap was even bigger for training adequacy. School staff averaged only 1.96,
Wow, below adequate.
way below, while allied health folks were 3.58. The study actually said this difference in training perception had a large effect size.
Meaning it's not just a small statistical blip, it's a really significant, noticeable gap.
Exactly, a really important finding.
So a big difference in how prepared they felt.
Mhm.
What about their views on, say, whether mental health work in schools helps with academics? Did they agree there?
That was another point of difference, actually. Allied health professionals were generally more strongly convinced that good mental health initiatives do strengthen academic performance.
Whereas school staff?
Were maybe a bit less convinced on that link, or perhaps saw them as separate issues more often.
Interesting. That could reflect different priorities or maybe just different day-to-day realities, you
It
know?
could be. And the study tried to get at the why behind these views through the qualitative parts, talking to people. School staff often expressed, well, reluctance to teach mental health.
Reluctance. Why?
Several reasons came up. Feeling untrained, like we said, the curriculum being absolutely jammed already.
No.
Right, no time. And some even mentioned worries about, like, legal risks, saying the wrong thing, maybe. One teacher actually said something like, teachers should not have to take this extra load on.
You can kind of see that point of view, can't you? If you don't feel supported or trained.
Absolutely. Meanwhile, the allied health professionals, they often said they weren't really sure what was being taught currently in schools regarding MHL,
Ah, okay.
or they'd observe teachers seeming hesitant, feeling ill-equipped, basically confirming what the teachers themselves were saying.
So it paints this picture of a system where everyone sort of sees the need, but there's maybe a lack of coordination or confidence.
And clarity on how to best tackle it effectively, yeah.
Okay. So given those different views, what does the study say about what mental health education actually looks like now in Australian schools? What's currently happening?
Well, it seems the most common type of program that falls under this umbrella are social and emotional learning programs, SEL.
Right? SEL, which for anyone listening usually focuses on broader skills like understanding emotions, setting goals, empathy, relationships, making good decisions, that kind of stuff.
Exactly that. And according to the people in this study, the specific mental health content within the curriculum often feels, well, a bit superficial.
Superficial. How so?
One person described it as, and I'm paraphrasing slightly, very basic information not really linked to young people's actual modern experiences.
So maybe a disconnect there, suggesting a gap between that general well-being focus of SEL and more specific education about, say, recognizing actual mental health issues or knowing exactly where to turn for help.
That seems to be the implication, yeah.
That's the feeling you get. The study does mention some topics that are covered. Things like resilience, emotional awareness, coping strategies.
Standard SEL type topics.
Yeah, and sometimes info on specific conditions like anxiety, depression, maybe eating disorders, and this seemed like a big but. There was this real concern raised, especially by school staff, about having limited resources to actually support students if they are identified as needing help.
The follow-through problem.
Exactly. There was one quote that really jumped out. I feel that a lot of schools are under-resourced, and we could be setting them up to fail.
Oof. That's a heavy concern.
It is. It's like raising awareness is great, but if the safety net isn't there when someone reaches out, it almost create more anxiety for everyone involved.
Yeah, identifying a need without the means to meet it, that's tough. So thinking ahead then, what kind of content did people agree should be in these MHL programs? Was there common ground?
Yes, thankfully. It's definitely encouraging that there was agreement on some core stuff. Both groups, school staff and allied health, strongly agreed students need to know where and how to seek help. That was huge.
Okay, help seeking is key. Makes sense.
Totally. They also both felt that basic mental health knowledge, those help-seeking skills we just mentioned, and general coping strategies were all vital things to cover in schools.
Right, those seem like the absolute fundamentals for building good MHL for young people.
They do. But then there were some interesting differences in what each group prioritized beyond those core bits, important nuances, you know?
Like what?
Well, school staff really emphasized needing a proper introduction to the program for students, making sure they understood what it was about.
Okay, setting the stage.
Yeah, and focusing on building mental health vocabulary, giving kids the words to talk about this stuff, and also actively tackling stigma.
Vocabulary makes so much sense. You need the language, right?
Yeah.
And stigma.
Yeah.
Yeah, tackling that early seems crucial if you want kids to actually ask for help.
Totally. Now, the allied health professionals, their extra emphasis was a bit different. They stressed normalizing mental health generally.
Making it less other.
Exactly, making it clear it's just a normal part of life, like physical health. And they also wanted students to understand what therapy actually involves.
Demystifying therapy. That could definitely help reduce hesitation about seeking professional support later on.
Hmm.
Probably reflects what they see in practice.
That's what I thought too. Interestingly, both groups kind of flagged discussing family mental health and heritability as tricky areas.
Oh, well, so.
They just felt those could be really sensitive topics to handle in a school setting, given all the different family backgrounds students have. Could be quite delicate.
Yeah, you can definitely see how that might need very careful handling in a classroom.
For sure. And one more subtle difference on stigma, actually. While school staff saw tackling stigma head-on as important,
Yeah.
some allied health pros worried that focusing too much on the word stigma might accidentally reinforce negative ideas. A really nuanced point there.
That's interesting. Like, don't give it too much airtime.
Maybe something like that.
Yeah.
So, okay, considering all these different views and priorities, what kinds of suggestions did people offer for actually designing future MHL programs?
They had some really practical, insightful ideas, actually, coming from both sides, the sort of day-to-day school reality and the more clinical or therapeutic perspective.
Okay, what did the school staff suggest?
They really stressed, number one, fitting it into the packed curriculum. It has to be manageable.
Of course. Reality check.
Absolutely. And making sure content is genuinely age-appropriate for different year levels.
Yeah.
They also pushed for a whole school approach, not just isolated lessons. Especially important, they noted, for rural or remote schools.
Right, where resources might be even tighter.
Exactly.
Yeah.
They also wanted mental health, framed positively, focusing on strengths and well-being, not just problems. And, this came up again strongly, the need for proper support and ongoing training for the staff delivering it.
That training piece just keeps coming back, doesn't it? All sound like incredibly practical points that would make or break an initiative in a real school.
Totally. Now, the allied health professionals, they echoed some things like being mindful of time constraints, but they also brought up things like considering students' varying abilities for self-reflection.
Developmental differences.
Yeah. They suggested maybe broadening the discussion beyond just anxiety and depression to cover a wider range of mental illnesses, but maybe, counterintuitively, focusing less on specific clinical diagnoses in the classroom setting.
Interesting. Why less diagnosis focus?
Perhaps to avoid pathologizing normal experiences, or maybe because diagnosis is complex and not really the role of a school program. They didn't elaborate hugely, but it's a thought-provoking point.
It is. Anything else from them?
Yeah, some even suggested exploring ways to incorporate established therapeutic techniques, maybe simplified versions, into the programs.
Bringing evidence-based therapeutic ideas into education? That's an interesting potential direction.
It really is. Now, the study also asked people about the specific programs they were already using in their schools. What did that part show?
Yeah, that gave a really useful snapshot of what's actually out there on the ground.
So what are schools using?
Well, participants mentioned quite a range. The researchers grouped them into sort of SEL programs, specific MHL programs, and then more general well-being ones. Some specific names came up that people might recognize. Programs like Friendly Schools, Mind Matters, Smiling Mind, BU, Teen Mental Health First Aid.
Yeah, some of those are pretty well known in education circles.
Definitely. They also mentioned broader frameworks being used, like school-wide positive behavior support and something called the DNAV model.
Right.
But interestingly, 10 participants said their school didn't actually have any specific formal mental health program in place.
10 out of 88. Still a chunk.
Yeah, it highlights that it's not universal yet. There are still schools where this isn't a structured thing.
That definitely underscores the need for a wider rollout, doesn't it?
It does, and the researchers kind of concluded from this that overall, the schools involved seem to be focusing more on those broader areas: resilience, social skills, managing emotions.
The SEL stuff again.
Yeah, through their current efforts. Which brings us back to that potential gap we talked about earlier between general well-being work and really targeted MHL education.
Right. The specific literacy part might be getting less mention.
Seems that way. So as we kind of pull the main findings together, what would you say the key barriers and needs that this study really shines a light on?
I think it hammers home a few critical points. Firstly, that teacher reluctance or hesitation we talked about.
Yeah, due to lack of training, curriculum pressure, legal worries.
Exactly. Those are major obstacles. And that big difference in perceived competence between school staff and allied health pros, that's a huge takeaway.
It really points to a massive need for targeted, relevant training and support for teachers, doesn't it?
Couldn't agree more. But on the flip side, it wasn't all negative. There was really strong agreement across both groups about how important preventative approaches are,
Okay, good.
and about needing MHL in the curriculum and making sure staff get adequate training. They also saw value in using informal chats, classroom discussions.
As opportunities to talk about mental health.
Right. Recognizing those moments happen anyway, so let's equip staff to handle them well.
That makes sense. Those informal conversations are probably happening constantly. The key is making staff feel confident guiding them.
Precisely. The study also flagged a concern that some programs being used might lack a strong evidence base.
Ah, so not necessarily proven to be effective.
Potentially, yeah. Something schools need to consider when choosing programs. And finally, the researchers really stressed the need for much better collaboration
Between who?
between school staff and allied health professionals. Collaboration in actually developing the MHL programs and then in implementing them ongoing.
That collaborative piece feels absolutely vital for bridging that confidence gap and making sure programs actually work on the ground for both students and staff.
Yeah, it seems key.
Okay, so for everyone listening, the key takeaways from this deep dive seem pretty clear. There's the significant gap, isn't there, in confidence, in perceived training, especially between school staff and allied health folks when it comes to MHL in Australian schools.
Definite gap.
And while everyone recognizes the need, and lots of programs are being used, they often lean towards that broader well-being, maybe not hitting the specific MHL targets as strongly.
Right, the focus might be slightly off.
But the insights from the people actually doing the work, the teachers, the counselors, they give us really valuable clues about what content, what support is really needed to move forward. It really highlights how important it is to listen to those voices on the front lines.
It absolutely does. And it kind of leaves us with a final thought, doesn't it? Something for you listening to mull over.
Go on.
Well, given how central schools are in young people's lives, how influential, how can we actually bridge this gap in confidence, training, resources, to make sure all students get effective MHL education?
Yeah, how do we empower them? So they can spot when they need help, know where to go, and actually have the skills to look after their own well-being.
Exactly. And maybe even more personally, now that you listening are more informed about this, what role could you play? Maybe in advocating for change or supporting efforts in your own community, your own context.
It's a big question.
It is. But this research, as the study itself says, it really gives us a vital starting point. A starting point for conversation that, well, is clearly much needed and needs to continue.